am pleased and honored to be here today, and I want to welcome you, Mr. Vice President, Secretary Azar, to our wonderful state of South Carolina, and also to be here, to be joined by Congressman Timmons and Duncan, Governor McMaster and Lieutenant Governor Evett, and our partners at PRISMA. It is quite the honor. Our ability to begin distribution of a safe and effective vaccine really does represent a critical turning point in our historic battle to stop the spread of this virus. Together with these federal, state, and local partners, the Department of Health and Environmental Control is committed to ensuring that everyone who wants to receive a vaccine in South Carolina will eventually be vaccinated. South Carolina is prepared for this next chapter. Our intensive planning for the arrival of the vaccines, in coordination with our federal partners and our local ones, through our South Carolina COVID-19 task force, has been focused on supporting an ethical and equitable distribution and allocation of the vaccines across our communities. However, as this vaccine first becomes available, the number of doses, as Governor McMaster has noted, will be limited in South Carolina, like it is in all states. We ask everyone to be patient, wait your turn, and listen to the public health officials. Our ultimate goal is to save lives, but with these limited initial supplies, we will need to do this in the phased approach that Governor McMaster has described. This means prioritizing our vaccination efforts to ensure the most vulnerable among us and those who keep us alive are vaccinated first. Similar to my previous role when training as a surgeon here in Greenville, our state must now take the difficult action of triage. We must triage our resources and attend to those in most urgent need of our support first. Our South Carolina COVID-19 Vaccine Advisory Committee, comprised of representatives from many different groups of people in our communities, has met weekly for months and continues to meet weekly to draft recommendations, as Governor McMaster laid out, for a phased allocation. They've reviewed the CDC's Advisory Council on Immunization Practices Phase 1A guidance and provided their recommendations, which align with this national strategy. South Carolina will be vaccinating those in Phase 1A as recommended by the state's advisory committee with that overarching goal of preventing death. This includes attending to our frontline healthcare workers first. Those are the workers in the hospitals who are the most critical for saving lives and most at risk for exposure to COVID-19. As Governor McMaster said, these are some of our nurses, physicians, respiratory therapists, laboratory and radiology technicians, and many other medical professionals who are treating COVID-19 patients. He has laid out very well some of the other groups that are in Phase 1A, so I'm not going to read them again. But from the front lines to the front of the line, our frontline medical personnel have really fought heroically throughout this event response to protect the health and safety of every one of us. And they did this while knowing that they were at high risk of contracting COVID-19 themselves. This is our way of protecting these frontline healthcare workers first so that they can continue to protect all of us. We must also take the swift action to protect those among our most vulnerable. That includes ensuring the patients and staff in our long-term care facilities are among the first to receive the vaccine. We have opted into the pharmacy partnership established by the federal leadership of the Operation Warp Speed and those here today, which we want to thank them for. Under this partnership, South Carolina has allocated vaccine to our long-term care facilities, which will be administered by CVS and Walgreens. By utilizing this partnership for vaccination in our nursing homes and assisted livings and other similar facilities, DHEC can focus its attention on the logistics of providing vaccine to those other groups that are in Phase 1A. This is being performed in close partnership with local providers, such as PRISMA Health, who is here with us today. Together with South Carolina's Emergency Management Division, its National Guard, its Hospital Association, and Law Enforcement Division, along with these local partners, DHEC is operationalizing the state's vaccine plan, which, as we appreciate CDC and HHS reviewing and providing feedback on. DHEC is confident that enough vaccines will be available for the general public very easily within the next year, and we appreciate Secretary Azar's update on where that stands. Until that time, though, we all have to be patient and continue to wait our turn. Until the vaccines become readily available, we're calling on all South Carolinians to step up by stepping back, to allow the public health care professionals to do their jobs and provide the vaccine quickly to those who are at highest risk of spreading the virus, contracting the virus, or at highest risk of death. And so we want all South Carolinians to understand that it will take some time to vaccinate a large enough portion of the population to allow us to change some of our current safety practices. This means we all must continue to act by taking those small steps that make big differences. Wearing your mask, getting tested and staying home when you're sick, avoiding large group gatherings, and practicing social distancing. We just need everyone to hang in there a little bit longer. And we acknowledge, as been noted, that some people are skeptical of not just this vaccine, but of all vaccines. Mm-hmm. We're fully aware of the vaccine hesitancy, and we absolutely understand why some people may feel this way. But I want people to know that these COVID-19 vaccines are safe and effective. We got here quickly because we had such a head start on developing them and because of the excellent leadership of Operation Warp Speed. Picking up where fellow scientists and medical professionals began with previous outbreaks, such as related coronaviruses like the SARS outbreak, has led our scientists now to be able to move forward very quickly at such impressive speeds to develop the proven and safe and effective vaccines against COVID-19. And we know that no vaccine will be authorized for use without being subjected to the rigorous testing and independent review that's required by both the FDA and CDC. And so with that, I want to thank you again, Mr. Vice President, Secretary Azar, and our other distinguished guests for being here today. We look forward to continuing our work with our federal partners, the governor, and our other state partners, the rest of the members of the COVID-19 task force in the state, and our very important local partners, exemplified here today by PRISMA, to ensure a fair and equitable distribution of this vaccine and put an end to COVID-19. Together, we are one huge step closer to ending this pandemic. I would now like to ask Dr. Eric Osmond from PRISMA Health Upstate to speak on the local perspective. Dr. Osmond is PRISMA's Chief of Preparedness and a practicing emergency medicine physician. Dr. Osmond?
Very good. Thank you, Dr. Traxler. And I am incredibly honored and awed to be sitting here today, 10 months after the beginning of the onset of this virus. This has been an incredible journey, and I am simply a humble representative of a very large organization at PRISMA Health and the University of South Carolina. We have thousands of team members now working tirelessly across the upstate and the Midlands, taking care of COVID-19 patients. In fact, we have over 270 in the hospital right now. So this is a remarkable achievement. The fact that this has been done in 10 months is even more incredible. So I just want to start by saying I think the key to our success in all of this has been the strong partnerships and the leadership we've had at the state level and at the federal level. From the very get-go, when we reached out to the governor, when we reached out to Dr. Traxler and the DHEC staff, when we reached out at the federal level, we found willing partners, and that is what has allowed us to get where we are today. The vaccine, when it comes, we are ready. We have had teams in place since early summer across this large organization working to figure out how the last mile of administration is going to work. We have had groups from pharmacy, from the clinical side, from the administrative side, so when the vaccine arrives, we will be able to receive it, we'll be ready to store it, we'll be able to administer it, and I don't think we're going to store a lot of it because our teams are very ramped up, and as soon as we get it, we're going to be putting it in people's arms. So, you know, as much vaccine as we can have in South Carolina, we will administer. Our teams have done some really novel things, using drive-through lines for testing, using telehealth, and we're going to leverage all of those capabilities for the vaccine administration. So I would say to Dr. Traxler, thank you for your leadership. It's been a pleasure to work with DHEC, and importantly, I really do want to recognize Vice President Pence, Secretary Azar, Representative Duncan, Representative Timmons, Governor McMaster, and the Lieutenant Governor, because without all of you here today, this would not have been a 10-month process. and lives will be saved, and people will be comforted. So I would like to thank you again, and happy to take any questions.
Great job, Doctor. Great job. Well, I think we give a round of applause to the Lieutenant Governor and these great team members here in South Carolina. That was very inspiring. Thank you, Governor. I want to go, Dr. Osmond, thank you, and thank you for so modestly representing so many extraordinary men and women in the healthcare community here in South Carolina. I hope if they are not looking on or don't see a clip of this, I hope they know that there's never been a day gone by that we haven't thought about those suffering with the coronavirus, and we haven't thought about all the incredible men and women caring for them. And so I want to express our appreciation. I thought I might just ask Dr. Osmond to expand for a moment. I appreciated you amplifying a point. I haven't heard it put quite that way. You said we won't be storing much of this vaccine. You said when we get it, we're going to be putting it in people's arms. Can you talk about that time frame? And then I'm going to turn over to Dr. Traxler for another follow-up on some of her thoughtful comments. But how quickly in the state's distribution plan do you at PRISMA anticipate literally administering, assuming that we get an approval in the next several days and ship it within 24 hours?
Right. So we have taken the DHEC plan and the federal plan, and we have operationalized that at the PRISMA level, identifying very specifically who are our at-risk frontline workers and in the order of vaccination that we're going to perform. We're going to be using two of our largest facilities initially here in Greenville and then also in Richland as the hubs for vaccination. So as soon as we have the vaccination within the system, we're going to start notifying these already pre-registered employees that it is available, and they will self-schedule into a slot, and we're going to have teams from our employee health, our business health, and all across the organization prepared to give those immunizations. So as I said, we are overjoyed that this day has come and are prepared to execute.
And so, Dr. Osmond, you're saying under the governor's 1A plan that you've already pre-identified the healthcare workers who fall in the categories. I think, Governor, you said it was healthcare workers that are at the highest risk, healthcare workers that are most essential in dealing with those struggling with the pandemic. So those people already know they're on the list and will be in line to get the first round of vaccine.
Yes, sir. We've already pre-identified those individuals.
Well, I think Governor, that's really commendable on PRISM's part, on your part. But I want to encourage people with Mr. Secretary that they're very, very similar to the plan that virtually every state and territory of the country has. And so the speed that we're talking about here, shipping within 24 hours, literally going into people's arms within 24 hours is all in the works. And I like the way you put it, and I thought it'd be good to have you amplify that, and I appreciate it. And thanks for your kind words and your great work, Dr. Osmond.
Thank you, sir.
Dr. Traxler, I really appreciate your work and your thoughtful comments. You described that the state of Carolina was going to put the priority on those most vulnerable and those who are there for people struggling. And that's consistent with the broad outlines that the CDC approved. But you also described this as a critical turning point. We all have to have patience. While it may be days before this is approved, it will be months before every American that would like a coronavirus vaccine could have one. But I thought I might just let you expand a little bit more, Dr. Traxler, on the prioritization, particularly with regard to those in long-term care and nursing homes, and the staff and the residents there, what affirmed the priority there and how significant. You might, just a thought on critical turning point. We all feel that way. As I said in my remarks, we feel like this is the beginning of the end. But I was struck by you talking. This is really a turning point. I thought it might give you a chance to describe that from your great healthcare background.
Certainly, and thank you, Mr. Vice President. So I agree that hope is present. This is really a pivotal change because we are seeing this vaccine not just as a hypothetical in the future, but it is a reality now, thanks to the strong leadership of your administration and Operation Warp Speed. And so we do see these two groups as really being the initial ones that we want to receive the vaccine, those frontline healthcare workers that are saving lives, and then those that are vulnerable in the nursing homes and assisted livings. As the governor had noted earlier, roughly 40%, it varies from moment to moment, but of our fatalities from COVID-19 have been in our long-term care facilities. And so we want to protect those individuals, both the residents and the staff who continue to go to work and serve and take care of those people. And so we have allocated roughly half of this first numbers of doses. We're anticipating between 200 and 300,000 already by the end of the calendar year from Pfizer and Moderna. And so roughly half of that will be going to the partnership with the pharmacies for CVS and Walgreens to be immediately right away, as you guys have so wonderfully operationalized, into these facilities to start vaccinating. And then the other half will be going to these frontline healthcare workers, which will, as we've heard so nicely from Dr. Osmond, are ready to go and ready to put it in people's arms.
Amazing.
And so that's where we're really seeing this making such an impact so quickly already, even by the end of 2020.
And are you confident, Dr. Trexler? I mean, we've got great partners, Secretary, don't we, with CVS and Walgreens. They will actually be going into the nursing homes. They'll actually be administering the vaccines, both to seniors who are residents as well as staff. And you're comfortable with the priorities that the governor and your administration have outlined. We'll move out efficiently with seniors with that initial round.
Absolutely, sir. This pharmacy partnership that you all established is allowing us then to put our operationalization into the frontline healthcare workers, because we have full confidence in CVS and Walgreens and their abilities to vaccinate in these facilities.
Great. Well, that's a great affirmation, Dr. Trexler. Thank you so much. And we, one of the heartbreaking things we realized early on is that seniors, particularly those with serious underlying conditions, are the most vulnerable to heartbreaking outcomes with the coronavirus. And as Governor, as you said, some 40% of our fatalities in this pandemic have been in long-term care facilities and nursing homes. So I want to thank you, Governor, and thank your team for putting a priority on our seniors, and just as importantly on the staff that are coming and going from the community back into the facilities to keep our seniors safe. We really believe it'll make an immediate impact on saving lives by really focusing vaccines on the point of the need. I'm going to give it back to the governor before I make any final comments, but I'm very partial to number twos, so I didn't want to not take a moment to say to Lieutenant Governor Yvette, thank you for all your great work in this. You've been a terrific partner as well. Thank you for your eloquent comments today. But more importantly, I'm very aware, we all are, of the way you've worked hand in glove with the governor throughout this entire process, and I want to thank you personally for your dedication. Governor, any parting thoughts for the people of South Carolina or for us members of the task force or these congressmen?
Only these. I want to say again that we all appreciate the great determination and effectiveness and foresight and innovation of President Trump and you, Secretary Azar, and others who have, as Dr. Osmond so well explained, and Dr. Traxler, to make this moment possible. I don't know if any of us have ever seen anything go this quickly and this smoothly so far, and I'm confident with the plans and the coordination, collaboration, and cooperation that exist among all of us, it will continue to be a historic event. And on behalf, again, of over 5 million proud, happy South Carolinians, some born here and the rest who got here as quick as they could, we thank you very much for your work.
Well, thank you, Governor McMaster. Thanks for your great leadership, members of your team who are here, these two great congressmen I know. I speak on behalf of Secretary Azar, our entire team, and our president when I express appreciation and our ongoing commitment to partner with you until the day we put the coronavirus in the past. We've been through a very challenging year in the life of this nation, and I'm truly grateful, Governor, for your leadership, for the tireless efforts of your team. I'm grateful to the healthcare workers on the front lines, as Governor Duncan so eloquently said. We just appreciate the heroism that's been demonstrated quietly each and every day in the hallways of our hospitals and clinics across the country. But we're also just very grateful to the people of South Carolina for your cooperation over the course of the last 10 months. And with Operation Warp Speed in full effect, and with us just perhaps a few short days away from having the first safe and effective coronavirus vaccine, I'm proud to report to the people of South Carolina that hope is on the way. But we want to encourage each and every one of you to continue to do your part. While we anticipate have some 20 million doses to administer to the most vulnerable and to our healthcare workers all across this country in the days ahead. With rising cases, rising hospitalizations, we just simply want to encourage everyone in this great state and all across the country to just continue to do your part. We all know what to do to slow the spread, to flatten the curve, and to save lives. And we just encourage you to do that in every way possible. Wash your hands, practice social distancing. As the governor said, stay outside as much as you can, keep those windows down. Wear a mask whenever you can't social distance or whenever it's otherwise recommended and indicated. And I'm more confident than ever that we're going to get through this. We're going to get through this because of the extraordinary innovation of our research companies and scientists in this country, the extraordinary work of our healthcare workers, the dedication of people at every level across the federal government and here in your administration across the state government, with the cooperation of the American people and with God's help in this season of hope. I know that we'll get through this. We'll heal our land, and we'll get through this together. So thank you all very much. Governor, thank you very much, and it's an honor to be with you all.